Welcome to the deep dive. Today we're getting into something really fascinating. Methylene blue, or MB. It's this substance that kind of straddles history, chemistry, and surprisingly modern medicine. An old dye, but also a powerful agent even used in critical care.
It absolutely is a substance of contradictions.
Hmm.
And our sources today, they really lay out the tightrope you walk when using it. So the mission here is to give you a clear picture of the whole spectrum, everything from those strange, very visible side effects that are actually harmless to the really serious risks that mean you absolutely need medical supervision.
Yeah, and we definitely have to start with the most striking thing. If you get methylene blue, you're literally going to change color, for a little while anyway. You might look like you walked off a sci-fi set. Okay, let's talk about that blue factor. And we're not talking subtle here, are we? The sources say it's potent enough to actually tint your skin, lips, even fingernails blue or maybe greenish. I mean, how practical is a drug that does that? Though maybe a bit awkward.
It's certainly unique. That discoloration is the main sign, really, that the drug's in your system. And of course, the most common thing people notice is their urine turning blue or green. It looks alarming, but it's completely harmless. It's just the kidneys processing the MB, doing their job, clearing it out.
Right. But that blue skin or, blue pee could definitely cause some panic if you weren't expecting it. How long does that Smurf effect last?
That's the good news, really. It's totally temporary, reversible. Usually it clears up pretty quickly once the drug is stopped, maybe 4 to 6 hours, sometimes longer, like up to 2 or 3 days. It just depends on how fast your body metabolizes it.
Okay, so beyond the visual drama, the sources also mention other common side effects. Milder stuff, more annoying than dangerous.
Yeah, exactly. We often see things like headaches, maybe some dizziness, pretty standard with drugs that work systemically.
Hmm.
Also gastrointestinal things, nausea, maybe some mild stomach upset, diarrhea. That happens fairly often.
Anything to help with the stomach issues?
Oh, yeah. Usually taking it with food can really help settle things down quite a bit, dampen those symptoms.
And what about that weird taste? I saw notes on dysgeusia, like a metallic taste, or even adgeusia, losing taste completely. That sounds pretty unpleasant. Why does MB do that?
Yeah, it's a strange one. It happens because the drug itself and its metabolites, they circulate everywhere, right?
Yeah.
Including your taste receptors. So it directly interacts with them, especially the ones that detect metallic or bitter tastes. It's just a direct effect of the drug being all through your system.
Okay. So, managing the external stuff, the blue skin, what do we need to think about besides just waiting for it to fade?
Well, the discoloration itself, maybe slight irritation, that's usually just managed with, gentle cleansers, maybe some moisturizer.
Yeah.
But the key thing is sun exposure. There's a rare but serious side effect called photosensitivity.
Ah, so your skin becomes extra sensitive to the sun.
Exactly. It means you could get severe sunburns or reactions much more easily.
Hmm.
So while you're on MB, sunscreen is a must. Protective clothing, too. It's just better to be safe.
All right, so starting blue is memorable, maybe a bit weird, but not the real issue. The serious stuff is often invisible. Where's that line between, like, an annoying side effect and a genuine medical emergency? We need to dig into those serious, though thankfully rare, risks. This is why medical oversight is so key, isn't it?
Absolutely. The line really gets drawn when we talk about the brain and nervous system. The most dangerous interaction involves methylene blue acting as something called a monoamine oxidase inhibitor, or MAOI.
MAOI, I know that term. It affects neurotransmitters, right?
Precisely. It blocks the enzyme that normally breaks down neurotransmitters like serotonin. So MB stops serotonin from being cleared out as usual.
Hold on. If it stops serotonin breakdown, wouldn't that potentially be good for mood or something? Why is it only dangerous when combined with other drugs?
That's a great question, and it really highlights how tricky this substance is, that narrow therapeutic window. Serotonin is vital, but having way too much is toxic. So while maybe very low doses of MB on their own might have some minor effects, the huge risk comes because many people who might end up taking MB are already on medications that also boost serotonin.
Ah, okay, like antidepressants.
Exactly. We're talking about the really common ones, SSRIs, selective serotonin reuptake inhibitors, and SNRIs, serotonin norepinephrine reuptake inhibitors. The standard antidepressants many people are prescribed.
So mixing MD with an SSRI is like hitting the serotonin accelerator twice.
That's a perfect analogy, yes. That double whammy creates a high risk of something called serotonin syndrome. And this isn't just unpleasant, it's a potentially life-threatening emergency caused by way too much serotonin activity. So if you're on those common antidepressants, MB is generally a no-go.
Okay, really important point. What are the red flags? The immediate warning signs someone needs to watch for if they suspect serotonin syndrome?
You're looking for sudden, severe changes, things like confusion, feeling really agitated, a very fast or irregular heartbeat, dangerously high blood pressure, and muscle stiffness or rigidity. Any of those, especially together, mean you need emergency medical help right away. It is dose dependent, so high doses of MB alone can cause it, but that combination is the biggest risk factor.
Understood. And are there other groups who should just steer clear of MB entirely? The sources mention a specific genetic issue.
Yes, G6PD deficiency. That stands for glucose 6-phosphate dehydrogenase deficiency. It's actually a fairly common genetic condition, more prevalent in certain ethnic groups, and it's absolutely crucial to screen for this before giving MB.
Why? What happens if someone with the G6PD deficiency gets methylene blue?
For them, MB basically acts like a poison to their red blood cells. It triggers a really severe, dangerous reaction called hemolytic anemia. The body essentially starts destroying its own red blood cells very rapidly. It's life-threatening,
Wow, so screening is non-negotiable.
non-negotiable. And we also need to be really cautious with people who have severe kidney or liver problems. Since those organs clear the drug, if they aren't working well, the drug can build up to toxic levels much faster. What's really quite fascinating here is that MB's impact isn't just limited to neurotransmitters or blood cells. Its effects ripple throughout the entire body. It's profoundly systemic.
We mentioned headaches and confusion earlier, probably linked to those vascular or nervous system effects. But let's talk about the heart and blood vessels, because this is where MB gets really paradoxical, right?
Yes, this is where it gets incredibly interesting. Methylene blue can significantly raise blood pressure, and it does this very deliberately by inhibiting the pathway the body normally uses to lower blood pressure, the nitric oxide synthase pathway.
So nitric oxide usually relaxes blood vessels.
Yeah, exactly. It widens them. MB blocks that relaxation effect. It essentially tightens the blood vessels back up.
So it's not a bug, it's a feature, used intentionally in medicine.
Precisely. MB is actually used as a rescue drug in hospitals for treating severe, life-threatening low blood pressure hypotension, like you might see in septic shock.
Septic shock, right, where blood pressure plummets dangerously.
Yes. In sepsis, the blood vessels can get way too dilated, causing that pressure drop. MB helps restore that vascular tone, bringing blood pressure back up when other treatments aren't working. It's really quite stunning example of targeted chemical intervention.
That duality just hammers home the need for precision, doesn't it? Okay, let's quickly cover some of those other, maybe less intuitive physical sensations people might experience, like pain.
Yes, patients sometimes report various body pains, not just headaches, but maybe sharp, dull, or even burning pain in their arms or legs. Muscle pain, that's myalgia, or joint pain, arthralgia.
Hmm.
It's thought to be linked to nerve irritation or maybe how the drug affects cell metabolism body-wide.
And then there are those weird temperature feelings, suddenly feeling hot or cold or sweating more, which is hyperhidrosis. Plus, we should remember if it's given intravenously, IV, there's always that chance of pain or irritation right at the injection site.
Absolutely. And while many of these sensations are relatively mild, we have to stress the really critical warning signs again. Get immediate medical help for anything suggesting a severe allergic reaction, anaphylaxis, swelling of the face, throat, trouble breathing, or signs things are going badly systemically like a high fever, poor blood flow, worsening confusion, or other neurological problems.
So pulling this all together, if someone actually needs this powerful treatment, what do the guidelines say about how much to use and how to use it safely? The numbers seem quite different depending on why it's being used.
They are very specific and depend heavily on the use case. For that critical care scenario like treating methylglobinaemia intravenously, the dose is calculated really carefully based on body weight. Usually it's about 1 to 2 milligrams per kilogram, and it's given slowly, usually over about 5 minutes. That's a high dose under very close watch for a short-term acute problem only.
Okay. And what about the lower doses, like the methylene blue drops people might take orally? What are the typical amounts?
The oral drop dosage is way, way smaller. We're talking typically somewhere between zero point 0.5 milligrams, so half a milligram, up to maybe 4 milligrams total per day. And often that's split into smaller doses throughout the day.
Right. So even though it's a lower dose, it still minimizes those acute risks, but you still need that medical oversight, because even small doses can cause headaches or the skin tinting.
Exactly. Oversight is still key. Now, what about long-term use? This is crucial. If it's powerful enough for critical care, what happens if someone just keeps taking it daily for months?
Yeah, this is a really important point. MAB is generally considered safe only when used correctly for short-term situations, under that strict medical supervision. It is definitely not considered safe for long-term, like daily use.
Why not? What's the risk there?
The risk is cumulative toxicity. The drug can build up in your system over time. This can lead to ongoing neurological risks, including that serotonin syndrome danger we talked about, and potentially cause long-term damage to organs like the kidneys and liver. You just have to treat it with respect. It's not something for casual, long-term use.
Got it. And for people taking the liquid form, the oral drops, they need to be careful with how they actually prepare it.
Yes, precision matters a lot. Always follow the doctor's instructions to the letter. Use the specific dropper or measuring tool provided to get the dose exactly right. And critically, the sources highlight this, do not mix the drops in hot liquids or very acidic drinks like, say, certain fruit juices. Why? What does heat or acid do?
It can potentially affect the drug's stability. It might break it down or change it in ways that could alter how effective it is, or even increase its toxicity. So stick to cool, non-acidic liquids if mixing. And, the simplest rule is often the best. If you experience any side effects that worry you, just stop taking it and call your doctor or healthcare provider immediately. #OutOutro.
Okay, so the big takeaway here seems pretty clear. Methylene blue is this really potent substance with a long history, and it can be life-saving in very specific, critical medical situations. But it demands serious respect and absolutely requires strict medical supervision, mainly because of its narrow safety margin and those potentially dangerous interactions, especially with common antidepressants.
Absolutely. And what really stands out to me, thinking about it,
Yeah.
is just how paradoxical this compound is. We talked about how it's used to treat a serious blood disorder, methemoglobinemia,
Right.
but it can actually cause a different life-threatening blood condition, hemolytic anemia, but only in people with that G6PD deficiency.
Right. Wow, yeah. That contrast really highlights why that pre-screening, that personalized medical approach, is just completely non-negotiable with this drug, doesn't it?
It really does. The difference between a cure and a crisis can literally hinge on one specific genetic factor you might not even know you have.
A powerful reminder.
Exactly. It's a powerful lesson that these highly active molecules are often double-edged swords. You really have to know precisely how, when, and if to use them.
That's really well put. As always, we encourage you to keep digging into topics that interest you, but please always talk to a qualified healthcare professional before making any decisions related to your health. That wraps up this deep dive.